This video deals with the 8th grade GLEs for family and consumer safety. We're going to take a look at a couple of GLEs. The first one is media influence on health habits and decisions. We're going to analyze marketing techniques that influence consumer decisions like bandwagon, beautiful people, good times, different advertising techniques that try to get you to want to buy their product. We're going to talk about whether these things are positive or negative, and how they influence your health and your safety. So let's take a look at some terms. First term we're going to look at is consumer. Very simply put, it's anyone who purchases products. Now, depending on people's age and demographic and different things like this, advertisers are going to approach consumers differently to try to get them to buy their product. This is something that we want to be aware of as we go forward with the lesson. Second is consumer skills. This is how you, your parents, anybody who is a consumer, which is pretty much anybody, these are the tools that a consumer uses to make a smart purchase. For example, if one needs shoes, you can either go buy the Jordans or the LeBrons for $100+. You can buy a pair of some other brand of shoe that you're not paying the extra money for the name for. So just some skills, just some things like that to keep in mind as a consumer. The technical term is techniques that enable you to make wise and informed purchases. This is a term for this unit. Next is media. What is the media? This is a great question. Simply put, media is means of mass communication. However, if I were to ask you what the media was, some appropriate answers would be things like news on TV. That's anything from the local news to the national news to cable news networks like CNN and Fox that deliver information. Another form of media is, in this case, we're paying particular attention to, and that's advertising. And advertising used to be kind of in magazines, and it used to be on television. Now it's showing up more in social media, and even in the games that you guys might have on your devices and that kind of thing. So media is any kind of means of mass communication. Hey, buy this product. Let's get it out to the people we want to buy the product. Hey, listen to this story. Let's get it out to the people we want to hear this, who we want to hear the story. So that's media. Okay, another GLE we're looking at is consumer rights and issues. Identify and select appropriate consumer protection agencies that address various issues. You guys may or may not be aware of this, but there are a lot of different agencies, government agencies and private agencies that work to protect consumers, that work to protect people who buy things. The second GLE we want to look at when it comes to consumer rights and issues is identify and analyze consumer health issues and products to make wise decisions. You guys may have heard from time to time that somebody comes out with this new product and everybody loves it and it's great, and then all of a sudden they find out that it causes some kind of disease like cancer or something like that. There may be a pill that comes out that says it can do all these things, but it really does none of these things. So just something to look at. Another one of the GLEs for consumer rights and issues. So let's take a look at the terms. First thing we're going to look at is State Consumer Protection Office. Now we're going to look at this more in an activity we'll do in class, but just so you know what this is in general, its job is to mediate complaints, conduct investigations, prosecute offenders of consumer laws, license and regulate professional service providers. Okay, so that's kind of a big definition. I'm going to compare this to, let's say, if I were to ask you, what do the police do? You might say the police are responsible for maintaining traffic laws, for maintaining other laws. If these laws are broken, they might write a ticket, they might arrest people. Their job, their government function, though, is to keep the peace. Okay, if you take that concept and apply it to a consumer standpoint, there are agencies like the one in the bottom right here. That's a federal one, but whose job is to protect consumers. So if you go to I don't know, if you go to a store or something and you try to purchase a product and they do things that are illegal in selling you that product, whether it's marking it up illegally or doing something to the product that is illegal, whatever that might be. This is the office that you would contact, and this is the office that would prosecute the crime. State banking regulations, right? You guys probably you may have a bank account, you probably don't spend too much time banking, if at all, but state banking regulators have the job of supervising chartered banks. And a chartered bank is another way of just saying a bank. Bank of America, Commerce Bank, whatever bank your parents probably bank at. There are state institutions that regulate this. Another thing that states regulate is insurance. People buy insurance for everything from cars to houses to life, and the state insurance regulator's job is to enforce insurance laws. And simply put, another item that the state regulates are utilities. Utilities are gas, water, electric. They work to make sure that the gas company cannot raise the price they charge you for gas without getting permission. And it's their job to allow them to do that or not. It's their job to make sure that the companies are working within state and federal laws. Okay, another GLE we're going to look at is community services and careers. First thing we're going to do is examine the viewpoints and efforts of individuals, communities, and governments regarding societal health issues in order to make informed decisions. Basically, how does a community deal with different health issues that it faces? And the other one we're going to look at is analyze how health agencies are responsible for disease reduction, control, prevention, research, and education. So how do these health agencies, like a hospital, like a local clinic, deal with the reduction and control and prevention of different diseases? The main way they do this is through a healthcare system. This can be a national thing, it can be a local thing. A lot of times when you talk about a hospital in the area, a hospital isn't just a hospital. It has a lot of different departments and things going on within it that deal with very specific health-related issues. Preventative care is one of the most important things that we can do, and we try to spend a lot of time teaching you about this in health and PE. And the job is basically it's the steps taken to keep disease or injury from happening or getting worse. So we want to educate you on healthy eating, because if you eat healthy, it's more likely that you won't get sick now, down the road, things of that nature. We try to teach you to make good choices, because if you make good choices, you're less likely to get hurt or put yourself in a situation where you have some kind of life-altering injury or disease. Preventative care is the first and most important line of defense in dealing with different kinds of diseases or injuries. Allied health professionals. These are professionals who perform duties which would otherwise have to be performed by doctors or nurses. Okay, so we're talking about local clinics, we're talking about take care clinics, we're talking about different organizations like this that kind of are the steps before you might get to the hospital or doctors or nurses. Okay, health insurance. Been a lot of talk about this. We're going to talk about this in class. There are really two ways to get health insurance. One is through your job, and another is through the government. It's very difficult to take care of yourself, especially if you or a family member, I'm thinking your parents now, get sick, because healthcare is very expensive and it's very important to have health insurance. So we'll talk about that more down the road. Public health. When we talk about public health, we're talking about the overall general well-being of a community. And it basically involves efforts to monitor and promote the welfare of the population, right? So when you might hear studies. A study was done on this or that. I heard one this morning that said women who eat a lot of soy helps prevent osteoporosis, which is bone degeneration when they're older. People used to think if you ate a lot of calcium, this would do this. And they're finding now that if you eat a lot of calcium, it could actually increase your risk of heart disease in women who are older. So it's basically a national discussion, a national agencies, things of this nature that work to protect and take care of the public health. And that is the end of the video for